Hi guys, my name is Shanice Carrington. I'm a doctor of physical therapy, and today we're going to be talking about the knee and common injuries that can go along with that. Today specifically though, we're going to be talking about meniscus injuries, basically because of the injuries that Joel Embiid are having and Karl-Anthony Towns. We're going to kind of keep it more specific to the meniscus. So in regards to the meniscus, we have to go over knee anatomy first. We're all kind of starting on the same page. So your knee, same thing, is going to comprise of two joints. You have your femur, which is your thigh bone, that's going to articulate with your tibia. And right in between these two is like a fibrous cartilage material called your meniscus. Now your meniscus is meant to be a shock absorber. Every time your foot hits the ground, there's force that goes through your leg, and your meniscus helps kind of dissipate that force a little bit. Because if you don't have that, then you have force hitting your bones over and over again repetitively, and that force can lead to the development of arthritis, also known as knee arthritis, knee OA. So our meniscus is super important, right? We need it there for shock absorption. It helps for like adding a little bit of lubrication to your knee. It helps for balance, proprioception, all of that. So if there's a damage to your meniscus, there's a problem. So when there is damage to the meniscus, there's kind of like 2 to 3 options that normally surgeons are going to consider. One, you could just not do surgery. You can go through a conservative rehab where there's no surgery done. They work on the range of motion of your knee, the strength of the muscles surrounding your knee, your quad, your hamstrings, your glutes, and hopefully strengthening those surrounding muscles helps to offset the pressure in your knee and helps you live without knee pain. If not, then there's a surgical approach, and there's a bunch of different surgeries you can do, but we're going to specifically talk about like 2 main ones. So one is called a debridement, also known as a meniscectomy, which basically means that they're going in there arthroscopically. They're not even really cutting open that knee. They're going in with instrument-guided tools, and they're going to clean off the surface of the knee. So with your meniscus, sometimes there's like some fraying that goes along, like pieces of material almost like sticking up, so it's no longer a smooth surface, and that's not what we want. So they're going in just to clean off the surface, almost like shaving it down a little bit, which sounds like, okay, that doesn't sound too invasive, but there's a problem with that, because the more you shave it down, the more you're shrinking the size of the cushion. The more you shrink the size of the cushion, the more compression and forces are going through the knee and development of arthritis. So there is a consequence to doing meniscectomies. You can't just do them willy-nilly thinking there's going to be no long-term consequence. Now, on the flip side of that, you can do meniscus repairs. So they're going in, they're opening up that knee, they're going to be doing sutures, anchors, they're going to repair that tissue. So they're not going to shrink the height of it, but they are going to repair it. Now, because it is such a point of contact in regards to your knee, when you're doing a meniscus repair, there's a lot of precautions and restrictions in regards to the rehab. So you can't bend that knee too early, you can't put weight into it too early, because then you're disrupting the part of that meniscus that's healing. So there's a longer recovery time frame in regards of that knee. So I hope that kind of makes sense between like debridement, meniscectomy, and repairs. So in regards to the debridement, there is no restriction. You didn't cut through anything, so there's really nothing to wait to heal. You can put weight on that leg as soon as you come out from the surgery. You can start bending it as much as you can tolerate. You go through the rehab. It's a lot quicker. So now when we bring this back to, let's bring it back to Towns first. So Towns, first of all, both of them are 7-foot tall basketball players, right? So that's a lot of jumping and impact on such a big body of force. If anybody's more prone to getting a meniscus injury, it's going to be 7-foot tall basketball players. But Towns specifically, he had a lateral meniscus injury, and so they had to go through a repair for him. So his rate of return is going to be a lot longer. So his surgery was on March 12th. There's no way that he's coming back to play the playoffs in April. That's just not going to happen. But he should be fine to play come next year. Now, talk about Embiid, that's a little different. So Embiid didn't have a repair. He had a meniscectomy, a debridement, and that was in February. So he should be fine to return to play come playoffs. We're talking about like April 20th, give or take. Now, the only part that's interesting about him is I'm not sure, from what I'm reading, he's had a meniscus repair in the past on the same knee. So I'm not sure if that's going to impact his rate of return at all. But if it doesn't, he really should be back to play come April, and everything should be hunky-dory. So that's pretty much a little bit of a background, like of meniscus, what's to be expected, what the rehab kind of looks like. And like for Towns in general, that rehab is probably going to take like 5-6 months, and that's like a 2-month recovery. So different time frame because different injuries, different surgeries were performed. All right, guys, I hope that makes sense. And that's it for today's segment. I'll see you next time. Bye.